private-public partnership to help dialysis patients. And this is an area that you cannot sustain as a government. So with all the private sector people benefiting from the health sector, this is an opportunity for government to provide incentives to put them together to be able to take care of the few people on dialysis. Why do we make noise about this as if government has failed? It's not a responsibility of government. The management decision in Korle Bu of placement was an expensive decision. And for that matter, government coming in to help is a good step because we practice mixed economy where government has a right to intervene when it has to do. But for sustainability, government cannot do it. And we must create the enabling environment for the private sector to help. Mr. Speaker, I say this because in the budget is a new center for nephrology in Korle Bu, and that is state-of-the-art one that is going to attract a lot of people across the globe to come over here. We can't play the ostrich. We can't attempt to run this institution down by going for free things for the Ghanaian, and you cannot sustain it. Mr. Speaker, I say it here because my colleagues on the other side have made so much noise about this. I felt minority has to do their job, and they've done the job. But to me, I thought it was too much of politicization, which was needless. Mr. Speaker, why do I say that the NDC overtly politicized healthcare? There again, I go to La Hospital. Mr. Speaker,
yes.
La Hospital wrote a lot of reports and letters for the NDC and the John Mahama administration to have come to their aid. It was flooding. Structural integrity assessment shows that the building was over 40 years, it was collapsing. There were a lot of letters over them. In April 2017, the Minister of Health found the need to meet the Director General of Ghana Health Service with the management of LA. April 2017, and they saw the need to bring it down and to bring a new hospital. Mr. Speaker, why do we carry the press to go to the grounds to show as if the NPP's thinking of bringing a new hospital in LA was a mistake? Why do we take the press to go to that place to create the impression as if somebody don't like the Ghan people? If somebody loved them, the NDC could have loved them better because they had all the reports to have break it down. They didn't do it. Mr. Speaker, there again, it's overt politicization which is totally needless. Mr. Speaker, it is not only law which is stalled. In my region, in Ashanti region, Confanochi Maternity Project is stalled. It's stalled because the Paris Club external financing is under debt restructuring. And there is no way they can continue with that pace in Confanochi again. LAC was part. In the Eastern region where the president comes from, and then the Minister of Finance also comes from, their Eastern Regional Hospital is stalled. Why do we create the impression in Accra, of which LAC financing is external? You create the impression as if people don't like the people of the Ghana state, people don't like the people of LA. So, government has come to their aid. They have made available about 50 million from the GOJ to get the contractor to go on site. What are they going to do for the people of Ashanti region, whose maternity project is also stopped? Over politicization of healthcare would catch up on you people one day in future. Mr. Speaker.